A lot of people Oh, go ahead. Yeah. So a lot of people or organizations give a summary of their accomplishments. If you all were on the DDA a meeting earlier this week, they gave a summary of their accomplishments. And we kept saying SDN members did some of that. SDN members did some of that. So we contributed to some of those accomplishments. We're not going to do that today. We're not going to give a list, but we hope that we can, through our presentation, we can draw attention to some of the accomplishments that that happen because of the work that all of you do and the contributions that you all make to us. So again, we're welcome. This will be our last meeting for the year, and what a year it's been, right? It has required a tremendous amount of advocacy for people to self-direct this year, reminiscent of several years ago when we had to work so hard just to hold on to self-direction and to some of the flexibilities that we had. So we recognize that all of you have had tough years. The FMS situation has been horrendous, and it has taken a tremendous amount out from everybody to advocate for any kind of success. Liz? So we've done some reflection as we've worked towards a higher structure within the self-directed advocacy network, and we're moving towards more of a formalized organizational structure and bringing on more board members. So we've become very clear about who we are, who we've always been. Nothing has changed. We're just getting things down on paper a little more and really putting it out there. So we are the self-directed advocacy network. We exist to advocate. Our vision is we envision people with intellectual and developmental disabilities living self-directed and fulfilling lives with access to all of the long-term support services and supports that they need. And so our activities are geared towards that vision. Our mission is to advocate for participant choice, control, and flexibility, and the sustainability of self-directed services and supports. We do this through education, training, legislative advocacy, maintaining partnerships with state agencies and divisions in state government, and collaborating with other organizations committed to supporting people with intellectual and developmental disabilities. So obviously we center all of our actions and our work around advocacy to maintain the things that people who self-direct need to do so. Next slide. So several years back, when we felt like some of the decisions and choices and flexibilities were being taken away from us by policy, we had the mantra of put the self back in self-direction. And we meant that as it was in regard to policies. Well, we wanted just to bring that again to the forefront as an advocacy organization that advocates for the participant to have choice and control. We want to make sure that we're challenging all of us, all of ourselves, and all teams that are committed to self-direction to examine yourself. And are we going about our work in a way that puts the self back in self-direction or maintains the self? And that can be done through participation. And we often hear, especially from newbies, and I think many of you will relate to this because you're trying to tell someone about self-direction, and we hear things like, "Oh, my child can't do that. My child's nonverbal. They could never do that. They could never participate in hiring or firing." Or we'll hear CCSs say, "Oh, I have a client who's too low functioning for that." Or a CCS who will say, "Oh, the families couldn't handle that, the families I work for." And all those negative ideas about self-direction. So we really strongly believe that anyone can self-direct with the proper supports to do so. And there are ways that we have all found to have the recipient, the participant of self-direction, their needs and wants be known, right? Throughout the entire year, we pay attention to what the person wants their life to be through their actions. They may be able to tell us in words, they may be able to tell us in actions, so that when that PCP meeting rolls around, they may or may not want to physically participate, but they can be well represented in that. What's come to my awareness recently is language, and I guess that's something that's always been something. And let me know if any of you also identify with this, but the language that we use when we're discussing self-direction, I've seen a switch, I've seen a change, and I'd love to know if any of the rest of you have are aware or see this as well. We've moved away from I self-direct my services, or my son or daughter self-directs his staff. He's in self-directed, or the self-direction program. Or so again, we just want to just put it out there as an advocacy organization that exists to promote self-direction, that we are asking people to look at their language, look at the language you're using, because that's what other people are hearing from us. Those of us that are steeped in this model of service and steeped in the concept that a person self-directs their life to have the most fulfilling life they can have. And what language? I can just personally let you know that I constantly get referrals as a nurse, right? And I will get things that'll say, I have a customer who has, and they list all the health issues. Who are you taking people on your caseload? So that's an example of language. And I will respond by saying, if a person is interested in self-directing, they can contact me for a meet and greet. And if they would like to hire me, we can discuss that. But please don't send their health information to me prior to being hired. So that, just bring that to your consciousness, and then decision making. Again, we hear a lot of reference to the person not being able to make a decision because they function as an 8-year-old, or they function as a child, or whatever. Well, there's many people in this meeting right now who have figured out a way to interpret the actions and and thoughts and wants and needs and desires of the person with the disability, and certainly make way for their decisions to be made. So if that's all challenging to you and you're like kind of starting to get a little irritated with me, think about it. And I say these things to make you think and for thought-provoking discussion. And if you feel like you'd like to move a little more in the direction of the person self-directing, there are plenty of people with experience within this group. Just ask, and they certainly would love to share, not the board members, but other members of SDAN would love to share, and participants themselves, about how they have self-directed lives. Liz, you can move that. This is an illustration from Applied Self-Direction. They are a national organization that exists to promote self-directed services, self-directed lives. And then it's just another illustration that we can use as we train our staff, or you all train staff, and as you need to, like, sometimes we need to just tell other people what we're doing. And this is some language. The participant has choice and control over the what and the how and the who and the when. Okay, thank you for that. Thanks for indulging me on that. Just to, again, bring you back to what the vision and mission of this organization is. I'll turn it over to Alicia.
Hi, everyone. Alicia Wopat here. And I think you all probably have heard, received a letter from Maryland Department of Health regarding some changes that will affect us and our self-direction. Deputy Secretary Bernard Simons is leaving, retiring, and Nick Burton, who was collaborating with SDAN so amazingly all year long, has also resigned and is moving on. So I just wanted to let you know that if you hadn't heard, and to let you know that we'll be in touch with all of our members when we hear what the plan is going forward. So they will be with DDA through the end of the year. We wish them both luck in their future endeavors, and I think a lot of thanks go to both of them in terms of collaborating and listening to all of you. Sometimes it took a while, but we all stick with our advocacy, and we've brought them along to be good collaborators as well. So again, we wish them well. Next slide. Next slide. One more. Thank you. Public Partnerships, PPL, is back in Maryland and is open to participant referrals. I didn't know if you all, making sure you all know the most current things going on. The ARC CCR is temporarily not taking new participant referrals. GT is open, so there's two that are open to new referrals. There are both the ARC and GT are hosting educational webinars. I think I saw today from the ARC. They have one coming up next week. So pay attention to the emails so that you can take advantage of that to learn some more. DDA still continues to meet regularly with the FMCSs. They meet weekly as far as I understand it. The rapid response team at this point has become a response person. Christy is still fielding everything that goes to that email. I have understood from DDA that the number of emails that they receive per day has dropped tremendously. We're hoping that's because things are better for everybody, but one of the things we're looking to find out from you all today is it, and what issues remain. So I would encourage you all to use the ticket system if you're with the ARC, the phones systems for PPL and for GT, to continue to email the rapid response team email address and or Christy directly when there are issues that are that the FMCSs are not meeting. That's the only way really that DDA and MDH know what the current quality that we're getting from the FMCSs is. So please don't be shy about letting the FMCSs know when there's something wrong. Give them the 48 hours to get back to you and fix it, and then keep letting Christy know what's going on. So there were two additional advocacy things that SDAN has worked on most recently. So traditionally, when people self-direct, their budgets include approximately 14%. It's called fringe, but it's all of the things that all of the taxes and insurance that that people need to set aside in order for various taxes and insurance and all that to be paid. Historically, when live-in caregivers choose, they can use the difficulty of care option and exempt themselves from some of this 14% fee. And traditionally, if there were live-in caregivers who had chosen that, any leftover or unused portions of the 14% were available to be moved to another line item in the budget. Around, I guess, July, we were hearing that some of the FMCSs were requiring the 14% be sequestered in your budget, and that they were not going to be allowing that money to be moved. So we advocated. I know this affected a small piece maybe of our membership, but those it affected, it really did, and it was very important. So so we did lobby and advocate, and that has been reversed. So the current policy, the past policy and the current policy as far as DDA is the same, that after the quarter has passed and all the taxes and insurances have been paid, if there is remaining funds, those funds may be moved to another category with budget modification. So congratulations to all of us on a successful advocacy there. And another advocacy issue was we were learning that particularly the ARC had decided to place some fiscal year 2023 expenses into to the fiscal year 2024 category, we all were concerned that if 23 expenses go into 24, that 24's budgets might be short. So lobbying there has ensured that 23 expenses go where they belong, which is in the 23 budget. So they should, all things should be paid out of that. And perhaps you all want to take a look to make sure that that has happened in your particular budgets. I think, Liz, we were going to do a quick poll to see kind of where we were in terms of the FMCS and your status. So if you are still experiencing FMCS non-payments, please click all that apply. I guess everybody's seeing that since it's clicking along here. Give you a minute or two.
Go away when everyone does it.
When those little lines stop moving. So far, about half of you have
Oh yeah.
have answered. We'd love to hear
That's
from
assuming
as many of you as
everyone-
possible.
It assumes that everyone has an issue.
True.
Since we didn't put no problem in. Think we're good?
I think we're good. I mean, we're seeing in general that about 25% of the people who responded are having some payroll issues. About half are having vendor and reimbursement issues, and 16% say others. So if you care to drop something in the chat, just to let us know what categories those other fits into, so we can continue advocating on your behalf. We continue to meet with the DDA every week, Nick and Christy, through the end of the year. So, more information is better. Thank you. All right. Next slide, I guess. So just a quick note that there is a newer budget modification form. You all know that budget modifications are used when you need to make minor changes in the way your budget's spent. New services always will require a whole plan modification with a new budget, but you can move between categories and day services like personal supports, CDS. If you had day hab, those things can all kind of move around. The freed up monies from the 14% can be moved with the budget mod, and other things as well. So for details, obviously talk to your support broker and your CCS, but there's a newer budget mod form out there. And one of the nice things that it has, along with some minor corrections, is a text box at the very top of it. So you can explain the purpose of the mod and the date of the mod, so that if a person needed to go back and be able to track, here was our original budget, we did this modification in February for the purpose of moving funds from CDS to personal supports. Then we did budget mod 2, and so you'll be able to track it easily and directly on the budget mod itself. So hopefully that'll be helpful going forward. The other thing that we wanted to bring to your attention regarding budgets is their legislature passed an accelerated COLA. So we got our regular 4% COLA in July 1st, 23. We got the 24 COLA. So in January 1st, we're supposed to get the 25, 26, I think it is, COLA. So they're going to do an 8% COLA increase as of January 1. We have spoken to various people at the DDA and expect that those COLAs will be applied the same way the July one was. So what would happen is the increase in the rates for all the services that have rates will be calculated, and those funds will be added to participants' unallocated amount. And if such time comes as additional funds are needed, those would be available to the participant to either do a budget modification or if there's a new or budget update or plan update. So keep a lookout. Right now, the only way you would be able to verify that, I believe, is through your CCS. CCS can get into LTSS and see what a participant's unallocated funds are. So hopefully that'll be helpful as we cruise into 2024. Next slide. And I think this is you, Liz.
Me. So I just want to, you may have received a strange call from someone who knew your person's name, knew your name, and asked for their birthday. This could have been an effort by Liberty Healthcare or the contractors to reach you for an interview. They'll ask for your birthday. They can't say why they're calling, so it's very strange, and because of HIPAA. But if you get a call like that, it's likely going to be this. And it's part of this quality improvement organization program. It's a federal program that's dedicated to improving the quality of life and quality of services for Medicaid recipients. Currently, Maryland is seeking accreditation through the Council on Quality and Leadership, the CQL. It's a lot of acronyms here. And like I said, Liberty Healthcare is conducting these interviews. They're doing it for both traditional and self-direction. And it's you're as stakeholders, this is a good opportunity to say how things are going in and have an impact. So if you can take that call, it would be be a good thing to represent self-direction and have your voice heard. And on the last point, though, SDAN, this being their self-direction is unique. We want participant choice and control, and we want this to go not be an imposition, but to really be an advantage to us, and to keep those advantages throughout this process. So if you have any questions on it, please do contact us, and we'd love to talk it over with you and how we can help you with that. Thanks.
Back to me. So just an update, we have the sustainability grant. It's an ARPA grant, and we are forming work groups now. Many of you have already told Marla, who's running our contract, about your interest. If you have not done that yet, please do feel free to contact Marla at the email address there to let her know. So sustainability is, we're looking into the current state of affairs and policies. We're looking into what would a participant need in order to self-direct without their families. Many, I would say most people who self-direct right now do have families who support them. So what does it look like to continue on with self-direction when a family member may not be present? And so we're gathering all that information and intend to make some recommendations at the end of the, it's a 2-year project. It started last July. So we would love everybody's input because it's for participants to make sure that sustainability is there for people who self-direct their services. And then lastly, we had a wonderful response to our request for board members, lots of applications. We are conscientiously reading all the applications. We're going to be interviewing and selecting a couple of board members in the next weeks ahead. We also hope to harness all these amazing people to do some work with SDAN, even if it isn't on the board. We are forming several committees, and we would love to have some really dedicated people who have the passion to work on the committees and bring your ideas to the board on a regular basis. So we will be in touch in the next couple of weeks. Obviously, holidays make things a little harder. So expect to hear more probably after the first of the year. And next slide, I think, Beth, are you here?
I'm here.
Yay!
So good afternoon, everyone. I'm just coming to bring an update on membership since, as you may recall, I've been working with the SDAN board on some of their strategic planning. And one of the things that we've been discussing was membership. And we mentioned at our last meeting that we will be formalizing the membership, or SDAN will be formalizing the membership for a variety of reasons, but really just to help define the SDAN community and to strengthen the advocacy efforts. And also by defining membership, they'll be able to have more grant opportunities and perhaps give SDAN the ability to offer member-only benefits. So that's kind of where we're headed. So you will be on the lookout for an invitation to officially join the SDAN membership. It will be sent out to everyone on the current mailing list. All the followers are on Facebook. And we ask you to tell anyone that you know is self-directing or interested in self-directing to also check the website and join. Everyone will have until March 31st to join without a fee. Then beginning April 1st, there will be an annual fee of just $25 per year, but still a fee nonetheless for any new members. And as mentioned, the board is currently planning members only benefits. So we'll have more information on that and what that looks like, if it's, more special members only workshops or seminars or guest speakers that you'd have access to, templates, that kind of thing. So be on the lookout. Please keep an eye out for the invitation. We want everybody to be able to move over by March 31st, and then we'll look forward to new members joining as well after April. So thank you.
Thank you, Beth. Next slide. So this is just to let you know that there will be another self-directed services update webinar by DDA on September 18th at 2 p.m. And I believe we have the link to register here. There should also be a more formal communication coming from DDA. I have not yet seen that. Have you? Anybody else seen that? So we just wanted to let you know that was coming up and to save the time. I'm going to turn it back to you, Patty. Next slide.
So this one, the subject, the update, the webinar?
Well, Liz, can you do next slide?
Okay.
I think we've kind of concluding and maybe going to get into thoughts and questions.
So please take this opportunity to put your questions into the chat. Obviously, those of you that have attended a lot of our meetings, you know that we can't give advice in your individual specific situation. We can't take the time of everyone else for that, but we can answer some broad questions and certainly questions about anything we presented today. We always, generate more confusion and more questions. So please put those questions in the chat and we will open it up to those. Stay muted if there's some reason that you cannot put your question in the chat. We certainly will make the accommodation for a verbal question, but as you all know, doing these large groups, we need to have quiet so people can hear. So yes, I guess we could probably start off with the one I'm seeing the most, Alicia, and that is the one about the 14% discussion. People need to understand the 14% and then the concept of the savings of that. and then what to do if, and how to find out what's happening with their particular situation.
Yeah. Again, it is probably a smaller percentage of people that this affects. But so when you do your budget and you have direct support professionals working for you, the budget will sequester 14% for state taxes, federal taxes. I don't know, Liz or Carol, help me out with the other acronyms. But you know, unemployment insurance, and what's the other fourth one? Okay, well, so they sequester the money so that at the end of each quarter, the FMCSs are required to make payments on behalf of the staff person to the state for their taxes, the feds for their taxes. They have to pay for the unemployment insurance, and I can't think of whatever the fourth one is. Say again.
Workers' comp.
Workers' comp. Thank you. So with a difficulty of care exemptions, you can, a live-in caregiver can be exempt from some or, well, some of those fees. And so that 14%, the total amount may not be needed every quarter. So if you have live-in caregivers and they chose to file for the difficulty of care, there may be extra money in that category in the budget. If there is extra money in that category, it is available to be moved to another category if it's needed. So I don't want to make a bigger thing of it than it is, but there were some people with very tight budgets who may have the difficulty of care exemption, one of their staff, and that extra money would be useful. For many of you, there may be enough money in unallocated funds and you just don't need to mess with the detail there. But the options should be available to everybody, and you should know what your choices are. There were a few people specifically, and so whenever there was a few people who contact us, we know there's many more who have the situation. We're told that this 14%, the total amount of it, had to be accounted for at the beginning of your fiscal year budget, and that was a bit of a change from the way things had been budgeted before. So the policy sort of remains the same. There was an intervening time where it looked like the FMCSs were trying to do something different with the money, but we're back to regular policy. And you can check with your FMCS should be able to report how much money was in the category for the fringe and how much is left. And at the end of each quarter, whatever was left is available to be moved with a budget mod. I hope that helps answer the questions, or that question.
The next question is, will reasonable and customary rates be going up with the 8%?
I think so. If DDA follows, is that the rates?
The wage, the
Okay.
reasonable
So-
customary wages.
Wages. So if DDA follows what they have done before, then yes. I can't
The
say that I
next-
have a definite, nobody's confirmed that yet, but that has been the way it has been going.
The other question was about the admin role and how is that accessed now?
Do you want to take that, Carol?
Oh, okay. It's allowed, and DDA has made accommodations for that by being under the individual family goods and IFDGS, individual family directed goods and services section, and you can put the taxes and benefits and anything like that in that section. It comes from savings, from not using the full amount of the rate when you pay wages and direct support staff expenses like PTO or mileage.
Along with that one, somebody was asking the question, can you give raises without a plan modification and just with a budget mod. So if your plan said you were going to give somebody $25 an hour and you now want to be able to give them a raise, can you just do a plan mod, or must you do a budget? I mean, do you have to do a plan mod, or can you just do a budget change?
I can't answer these questions because the rules seem to change on a regular basis. And I think that once the reasonable customary was there, you could just do a change form because they knew that the employee change form with the ARC. I have no idea what GTI does for raises and things like that. And they would let you go up to the new max rate. If you have to put more money into the budget form, it sounds like the ARC wants a budget mod and then a whole new budget form. So we repeatedly say that doing a whole new budget form is just asking for confusion and errors, but we're not making a lot of headway on that.
Yeah, not sure if I caught the question, but there have to be a way to tell, in the budget, you have that maximum wage. You have to be able to tell the FMCS what you want that maximum wage increase to in the budget, which is different than the increase that you give to your staff. So, because staff might have different. So to do that, you do a budget mod. So you get and I hope I got the question right. So to get that access to higher wages, you do a budget mod telling the FMCS to raise that rate in that line item in personal supports, or if that makes sense.
The one question is who does the budget modification? So
I think you have to involve the CCS.
Yeah, the CCS has to be the one to submit them, but the team can work on them together.
Veronica answered that differently in there. So I think there's just a lot of confusion. She says the rules pertaining to budget mods are outlined on the budget mod form itself. Anyone may assist the participant with drafting. However, only an unpaid person can submit to the FMCS, which is the CCS, because nobody pays the CCS directly from their budget.
Hi, I unmuted myself just for a quick, so it could be an unpaid family member also, or the participant themselves. So I just wanted to clarify that if there was confusion.
Is that in writing
I don't
anywhere?
want to be contrary, but I think, so that to me, that's the IFDGS process, but the CCS has to sign the budget mod and they have to submit it.
They do have to sign it, but the way I've seen it done a few times, not often, because it's not often that a CCS wouldn't be the one submitting it, I guess I should say, but I have seen cases where an unpaid family member has been the one that obtained the CCS's signature on it, but then the unpaid family member submitted it with the CCS copied. So I have seen that done before. Now whether or not guidelines have changed and or if GTI shouldn't have been accepting those, I can't say, but it doesn't. I don't believe on the form itself it specifies that the CCS has to be the one that submits it. It just has to be an unpaid person.
Looks like something we can try to verify.
They're probably fine with it.
There was a question about individual family directed goods and services, and when do you submit a budget at the same, when do you submit a budget for that if you would need to make a change? So my understanding is once you submit that SMART form, asking for the approval to do that for that individual family directed goods and services, either service or item. Once it's approved, you would do the budget modification. The SMART sheet does kind of ask you the question, do you have the money in your budget already or not? And I think the purpose of that is to just let people know that if you don't, if the answer is no, that a budget mod will need to come if the item is approved.
Right. The only time you usually have it already in the budget is when you've just done an annual budget, you know, where you, the whole process with the PCP and the new budget. If you're doing it mid-year and you want to add an IFDGS, you probably have to do a budget map because it's probably not in your budget.
There's a question about the participant agreement. And it doesn't sound like that Sue Nestor is asked the question that she got the right information, so I'm going to put this out to the. I have recently been told that a support broker or anyone who is paid cannot be listed on the participant agreement under option 3 to assist the individual with making decisions on the budget, hiring or firing staff, disciplinary action, or issuing overtime. I have always assisted with these things, any information. My personal opinion is that's what the participant agreement is for, and you absolutely can be on there. And we fought really hard that a support worker could be on there. And any paid person. So,
Participant agreement?
I don't, what I would suggest is that you, push back.
Well, the participant agreement is what tells the ARC that a support broker is your support broker. So if they have to be on it.
I mean,
DDA,
go ahead.
no, DDA would say anybody on the team, even I mean, they were saying vendors, anybody can be on the participant agreement. The thing with that is, you know, whoever's on the participant agreement is generally expected to be in PCP meetings and all that. So you might want to just limit it to those people.
This is Sue. This was my question. This is
Yeah.
the first time it's come back to me. Actually, it was the service coordinator. This is the MARS, not service coordination. And they said that they have a quality assurance board who reviews
number
all
3.
plans before they go in, and that it has to be changed, that it can't be any person who is paid, that the individual has to do it. You know, their name has to go there, but then they would have to do it themselves.
No,
Everyone in
No.
the family, everyone on the plan is a family member.
that's,
And so
Hi.
I've been going back and forth with them.
I
Hi,
think
can
we,
I chime in on that 1 second? It's April and it was me who received that guidance, but I did speak to Christy, and Christy, Sue, just to let you know, I did respond back to the CCS. She said that a support broker may in fact be listed for any of those tasks. So I do apologize for that confusion, but yes, support brokers may be listed for all of the tasks. That was confirmed.
thank you,
by
April.
Thank you.
Thank you.
Alicia, could you
Yeah.
take a second here and give the people on the call a little bit, or Carol, a little history of how this participant agreement came about? Because I do recall many hours of us sitting with DDA staff and hashing out this document. Can you give a little bit of one of you
Yeah.
in there with that?
Carol might be better at it. Replaced something in the plan that was at the top of the plan. But the idea of the participant agreement is to make it clear and transparent what kind of help the participant chooses, whether they want to do it all themselves, whether they want somebody else to do it all and they want no control, or something in the middle, which is I think what most people choose, that they want control and they want to decide who's going to help them with various supports that they would need in order to self-direct. So the team gets together. It's usually part of the PCP planning meetings. It can be changed at any time, but the idea is this is a living document that describes how a participant wants their supports to happen, what categories they want help with, and whom they wish to help with. From the state's perspective, from DDA's perspective, it gives them some comfort to know if there are any issues with any of these various supports, who did the participant say I can speak to about this? So it's a document that lays out the intent of the team, of the person to get help, and of the person who's going to help them, that they are willing and agree to do it. So it's intended to be a very transparent and living document that can change at any time.
पाकिस्तान से लोग लेकिन तवज्जो नहीं देते ना
That's the intent of the participant agreement.
The other reason that item number 3 is there was because it was really 2 choices. I'm doing it myself where I have an authorized representative, and having an authorized representative took a lot of control away from the participants. So we fought really hard to get option number 3 to be flexible, to put people on there, and paid people can be on there. Someone asked about support brokers signing timesheets, and I heard that that is okay now if you're approved to do that, that you just can't sign your own. I don't know that I got that directly from DDA. I think so, but it's, anybody else remember DDA saying that, or I know I heard it from another support broker.
There's a question, somebody, I guess GT just asked for their participants EIN.
So
Usually
if you're due to self-direction,
Mhm.
then yes, GT should apply for an EIN. But if you're moving from another FMCS to GT, everybody only gets one EIN with the IRS. So there's already your son already has one, and the previous FMCS can tell you what it is. So you can tell GT.
I think it's also on some of the documents, the EIN.
Yeah, usually you'll get it in the mail, like get a hard copy.
Yep.
From the IRS when it's assigned, if all goes well. But if not, GT should have a copy.
So somebody's
The
asking about
previous FMCS.
Oh, sorry to interrupt. It is our understanding that the ARC is in the process of working on how to provide support broker access to the EVI portal. It is also my understanding that GT has decided not to do that. And I don't know where PPL stands since they're recently back in. So I don't, if anybody has any idea about what PPL's stance is, please put it in the chat.
Yes, Beth, thank you. She said that that's the CCS support broker and day-to-day administrator chart says that the support broker can approve timesheets, and that chart should show you that the support broker can do some of the administrative things. When this was first discussed, doing the administrative work was possible by the support broker, but only up to 30 hours a month. So basically 26 hours more than what they're adding to the budget for a support broker.
There's unable to, okay. So anybody know the process for medical insurance reimbursements? And I think it's just like a regular reimbursement. The person needs to have proof that they have a bill and that they paid it to be eligible to be reimbursed. So no matter which FMCS, there's the methodology to do it may be different, but you need to have the invoice and the proof of payment to submit for reimbursement. And that's true for all reimbursements, to the best of my knowledge. This is an interesting question. Somebody's asking, like, what should you keep hard copies of? What documents for self-direction is it important to keep hard copies of, or maybe digital copies of?
Yep.
Go ahead. I mean, if you have, I think this is an opinion thing. I don't think this is a factual thing. You know, different people, you know, tax documents, I think, are 7 years. If there's any reason to think that somebody might be coming back to look at something, you might want to keep a record, a digital, so that you would be able to print it out or send it, a digital record of plans, budget modifications. But most of the other, most of the other things are kept. The important things, somebody has a digital record of. LTSS has digital records of plans, and FMCS must keep digital records of their budgets. But I feel like it might be, it's a good idea to have an actual budget to compare to what your FMCS typed in there, because it's not transmitted digitally to their systems at this point. So anytime a human hand has had any access, made the conversion from the digital LTSS version of your budget into a FMCS budget, you should be able to get your hands on a copy to verify that it's accurate.
Alicia, it also begs the clarification or just the reminder that each participant is running a small business. You're an employer. And so just as any small business, you should be keeping records, and you should hold on to those records because you were running a business. So how you do that and how often you do, or in what method you do that, is certainly individualized, right? But you are running a small business here. So and your medical records, you definitely have to maintain for the period of 5 or 7 years, whichever it is. But yes, so think of it that way. I think that there was a question about access to LTSS and the My LTSS, and do we have an update on that?
So this was part of all of our advocacy in the Self-Direction Act of 2022. It was stated that there must be additional transparencies. We have been working with the DDA on doing this for over a year. We were sort of promised something back this past spring, and then in the fall. My understanding is they're pretty close to having created the access points for self-direction to LTSS for the participant. And they are now working on some educational tools so that when they give us access, they also are telling us how to use that. I think in the last webinar I heard, they were thinking towards the first of the year in terms of being able to roll out the access to those who wish it, and the concomitant educational materials, videos or paper written documents that will tell us how to access it and what things are available to look at. So I don't know the answer, but that's what I heard most recently, is within the next couple of months.
There's a question about asking to define medical reimbursements. And we've had this discussion recently that the DDA is says that waiver participants can reimburse staff for a certain amount towards their health insurance premium. We've asked for after the first of the year and with the new replacements, especially Nick's replacement, to have a more robust discussion about benefits and what benefits can and cannot be paid out of waiver funds. So for now, we understand it to be money towards health insurance premiums, not co-pays or any other things. But we'd love to have your opinions, send them by email, and we will begin that broader discussion with DDA about benefits after the new people arrive on the scene, I guess, from DDA.
Yeah, I am seeing some conversation, and not really questions, but conversation about sort of a lack of consistent budget reporting. Consistent and accurate budget reporting, and I just want to let everybody know that we are seeing that, and it's been on our meeting agendas with the FMCSs and with DDA, and we've asked for another meeting regarding budget accuracy, so people know where they are in their plan year. So without something accurate, as Patty said, you're running a small business, but you don't have, your accountant's not doing their job. So, so we're hoping to get that, hoping to get the FMCS is better at reporting out to the participant where they are at any given time. That was intended to be part of the FMCS, the switch over from FMS to FMCS is real-time budget reports. And so far, pretty well lacking. I do think it's there. I don't think it's an intentional thing. I don't think anybody's trying not to do it, but it is certainly not happening. Let's just take another look and see if there's anything else. Somebody asked about the day-to-day admin reasonable pay. It's on that same chart, the reasonable and customary chart. There is a line item for the day-to-day administrator. Let's see. I mean, I think, so somebody's asking, can the support broker do some of the admin stuff as well? And I think that's a team decision, really. Support brokers are there to support the participant in ways that they wish to be supported, and so is the day-to-day administrator. I think you work on it as a team and decide whether your support broker wishes to do those things and whether the participant prefers that, whether there's a person who's going to be better at some of the day-to-day administrating, and to, you know, obviously small business again, define the roles of the people who you've asked for support. And
Here, I've got one. So just this is Patty again, and you know that I provide nursing support services. So I just wanted to put a mention out there that nursing support services are defined in the waiver. What a nurse is supposed to be doing for you is in the description of the waiver service. So if you hire someone to provide case management and delegation, what that person has to provide is listed in the service definition. If you hire somebody to provide nursing consultation, it is the service description is there. And so as the employer, you should be holding your nurse to account to provide the service. You've hired them and you are paying them. The nurse is just like any other vendor. We work for the individual, and we should be submitting our work and our invoices to you for your approval to the participant. And so nurses are not taught this. I have to do a little defense of some nurses. In our profession with DDA nursing, nobody is telling a nurse how you do self-direction. So you all need to. You know, you and your team, your CCS, your support broker, you and the participant all need to let the nurse know how they're supposed to work in self-directed services. Obviously, the nurse knows how to be a nurse, but they don't come into this knowing how to do self-direction. The DDA is not providing that education to nurses. So when you have a nurse, refer them to the nursing service definition that's in the waiver, what you're hiring them to do. You are still the boss, the participant, and who they elect to have them help them. And you should be holding that nurse accountable for the services provided. You should be receiving the documentation for the service provided, and you should see the invoice and approve or disapprove of that invoice. Many people contact me when they feel dissatisfied with what they're getting from a nurse. And so I just, wanted to put that out there, that you are the employer and the nurse works for you, works for the participant. So, and what is supposed to be done is outlined in the waiver.
we've hit on many of, if not all, of the questions. There's a lot more conversation going on. Just again, I'd like to encourage all of you to donate. to stay involved, to join. I'm assuming since you all are here, most of you are members. When we get the invitation out to you, I hope you all will convert over and take advantage of the free first year. And the nominal fee of $25, I hope will not stop anybody from continuing to be a member of SDAN. So thank you. We look forward to seeing you in January. Patty, do you have any further closing moments?
No, happy holidays. Hopefully this holiday season will be less stressful than last year when we were all preparing for the big January 1 FMCS transformation, whatever we're going to call that fiasco.
There's a
Happy holidays, everyone.
there's one question I just want to address in there about the exception form. There is an exception form that is, if you want to pay over the quote unquote standard max rate, you fill out that form and it's simply a checklist. They're not supposed, DDA doesn't get to decide what your reason is justified or not. They're supposed to just treat it as a checklist. You're doing it because the person has experience. You're doing it because the hours are like 1 hour here, 1 hour there, or that the remote location of the person that has to get it. There's a whole bunch of reasons of why you would be paying over and above that max rate. So just look for that exception form. That should be on the DDA website as well. So, and happy holidays.
Happy holidays.
Thanks for coming. Bye.
Bye.
See you soon.
Okay. We were getting a lot of basic CCS questions and support broker questions. Don't you think?
Yeah. Yeah, and there was, there's the people, oh, I need to work more than 40 hours and whatever.
Sorry. No, you don't.
But mostly I think it was
Not good for you. Take a break.
I think it was good.
Sorry.
We had a really good turnout, honestly, I think.
Oh, yeah, it was
That's
over 100
many.
people.
Wow.
111 was my top count.
We're still recording.
Rob will fix it.
Well, you're gonna have to fix that.
Oh, yeah,